Good afternoon. Thank you for joining us. My name is Nancy Hernandez. It is Hispanic Heritage Month. Hispanic Heritage Month started September 15th and runs until October 15th. And so us at the Hispanic Collaborative are happy to help with that celebration. We're really using it as a platform to share your voice, Latino voice, and key issues that are impacting our community, key discussions, and helping highlight those. We are very happy today together with MATC to bring you today's event where we will be talking about health disparities for the Latino community, COVID-19, and what's the relationship, where can we go from here? We are very happy that you logged in today. You'll be joining us. We are taping this webinar, so you will be able to share this with your friends and get this out there. They can watch it during their brown bag lunch sessions later. It will be on the Hispanic Collaborative website, mkehc.org. Today we have a great conversation lined up with a very important topic for all of us these days, and coronavirus is at the key of that. The first thing I want to do is introduce Dr. Wilma Bonaparte, one of our co-sponsors for this event today with MATC. She has served the Milwaukee Area Technical College for over 20 years and currently is the executive director of their Mequon campus. Dr. Bonaparte was MATC's district-wide director of all bilingual and basic skills programs from 1988 until 1993. She served as an associate dean in multiple roles and the dean of MATC's School of Liberal Arts and Sciences. Bonaparte holds a doctorate of education from the University of Massachusetts, Boston, a certificate in leadership from Harvard University's Institute for Educational Management, and a master's of education from Penn State University, and a bachelor's from the University of Puerto Rico. Boy, I feel very uneducated introducing you, Dr. Bonaparte. Thank you for joining us today, and please share a few words with us.
Oh, what a treat, Nancy. Thank you so much. What an honor to be with the Hispanic Collaborative and with you and your team. Nancy, really getting this program for our community. I have the pleasure of introducing Dr. Vicky Martin, the president of Milwaukee Area Technical College. Dr. Martin is recognized as an influential leader in our region for her commitment to providing access to college for all students who never thought it was possible through the MATC promise. She worked tirelessly to advance education in our community to ensure everyone had access to quality education, career advancement, and a better life for themselves and their family. With her leadership, MATC is well positioned to become the largest HSI institution in our state. Without any more, please, let's welcome our president of MATC, Dr. Vicky Martin. Take it, Vicky.
Well, thanks, Dr. Bonaparte. And what an honor to welcome everyone to another critical conversation as part of Hispanic Heritage Month. It's an important conversation for MATC. It's an important conversation for MATC because we serve more than 5,000 students each year, or 20% of our student population. Today, we will be discussing health disparities among Latinos and Latinas during the global pandemic of COVID-19. There are multiple reasons that make this population most vulnerable: health inequity, access to proper insurance, their role as essential workers in the workforce that may expose them to more vulnerability. Today, we have an opportunity to hear from experts in their field about the realities of this current scenario and in the ways in which we can begin to mitigate these challenges. We are stronger together, and the more we can collaborate, learn from each other, and work together, the better off we'll all be. We cannot thrive as a community if we have equity gaps in income, health, and more. So on behalf of METC, the HSI Task Force, the Diversity, Equity, and Inclusion Committee, and the Hispanic Collaborative, thank you, Nancy, our distinguished panelists, and participants for joining us today. Thank you.
Thanks so much, Dr. Martin, and thank you so much for all that MATC does. We are so happy about your commitment to the community, and we want to thank you for your participation. We're excited to bring our viewers another webinar later this week that we're also partnering with MATC on, which is a focus on Latino-owned businesses, certainly how the pandemic is affecting them, but we also want to talk about how are we going to grow that sector. As you know, Latino-owned businesses in the region, we're on the bottom of the list against our peer of 50 cities, and we're really interested in increasing that, not just because of the wealth it brings to our community, but because of the added leadership and investment that it also brings to our neighborhoods. So without further ado, let's meet our panelists. Our first panelist that we have joining us today is a stranger to no one, I think, on the call, Christy Garcia Thomas. So Christy Garcia Thomas is the Chief External Affairs Officer with Advocate Aurora Healthcare, the largest employer in the state of Wisconsin, but maybe a few more states before they are done. And although Christy comes to us via Kansas, the state of Kansas, it is very much like she is a native-born Wisconsinite, Milwaukeean, and has shown tremendous investment and care and concern about our local communities, and certainly part of that is the Latino community. She leads not just external affairs, but the diversity and inclusion efforts within Advocate Aurora. We are very happy to have her. Welcome so much, Christy Garcia Thomas. Our next person that we have joining us today is Drew Bacharacha. I am so sorry, Drew. I really practiced your name. It's a beautiful name, and I think I maybe just didn't do it justice, so you will have to help me with that. But Drew is with Advocate Aurora. He's the Vice President of Diversity and Inclusion. He also, before his time with Advocate Aurora, served as President and CEO of the Global Academy of Population Health in California. And he spent some time, population health and public health is a sweet spot for Drew. He also worked at the University of San Francisco in that area, as well as Loyola University Medical Center. Welcome so much, Drew. We are happy to have you on our panel. Our next panelist that we are going to be speaking with today is Dr. Julie Schuler, who is the President and CEO of 16th Street Community Health Center. She has led that organization for almost 4 years, but before that, she spent just a small amount of time also with the organization, 22 years as their Executive Vice President and Vice President of Clinical Affairs, where she really, you know, if we think about who knows our community, even though I was born and raised right there in the neighborhood of 16th Street, Dr. Schuler definitely knows community members in there simply from her role as caregiver and now as a leader of one of the institutions that are near and dear to the Hispanic community. Thank you so much, Dr. Schuler, for joining us today. Then we also have with us Rosa Martinez with 16th Street Community Health Center. She is their Vice President of Community Health Initiatives, a very important role, especially during these timeframes. She spent some time as their WIC director, and prior to 16th Street Health Center, she also worked at the Medical College of Wisconsin and UWM Extension. And we're happy to have her on here because she is an expert in health disparities and is going to talk us through that topic. So welcome so much to all of our panelists today. And we are excited to have all of you. We're going to get started with our first question that we are going to tee up for Dr. Schuler. So Dr. Schuler, 16th Street Community Health Center is at the center of the Hispanic community specifically. And since the start of this pandemic, it has been seeing firsthand what is happening. What the numbers look like, what the members of our community are saying as they're going through this, may be affected, maybe not, but while this disease works through our community. What can you tell us about the course that it is currently on, and what are we seeing in terms of infection rates today?
Well, thank you, Nancy. Can you guys hear me okay? All right, I am going to share my screen here and show you all some data. So 16th Street has been at the heart of testing in the Hispanic community since the start of the pandemic. Let me get this going. And here's where we are as of Saturday's data. So Milwaukee County has had 29,680 cases. You see we're at the middle, hopefully, of a third spike in cases, so a recent surge. What is happening to cause this recent surge? We think there's sort of been a perfect storm of factors happening. First, this recent increase in infection rates started with the colleges and universities several weeks ago, and some of the social behaviors that go along with being in college and the college students acquiring more of the COVID infection. UWM and Marquette have both had high rates of infectivity. Then that transitioned to not only just college and university students, but also to the general public as they became in contact with friends, family, etc. And so we have had more community spread. Also, in terms of the perfect storm of factors, the cooler weather has driven people inside, and the virus is more transmissible inside just because of there being closer contact with each other. There's easier viral transmission indoors, so that's been another factor. And we're watching, we think what we're starting to see is a cycle of infectivity where the infectivity lowers or the disease prevalence lowers. And so people get a little more complacent. Maybe they wear their masks less, maybe they decrease their protective behaviors. And then we see an increase in cases, and then we see us all being more protective of ourselves again. So it's kind of being this cyclical pattern that we're starting to see. We'll have to see if that completely plays out, but that's one of the current hypotheses. So that's the total cases. The Hispanic population has borne the brunt really of the infection here in Milwaukee County. As you can see, the green line represents the Hispanic race, and the incidence amongst Latinos has far exceeded the other races, as you can see from this slide, really since the beginning of the epidemic. The panel here is going to be talking about that through the remainder of the hour, and there's some interesting thoughts about why that's happening as well. This is another way of looking at the disparity or the prevalence of the virus in the Hispanic community. The map on the left shows the total number of cases of all races in Milwaukee, and the slide on the map on the right in purple shows the total number of cases within the Hispanic community. And you can see that the Hispanic community is really driving the positivity rates in the whole county, where it's been prevalent in the Hispanic community is exactly where it's prevalent in the whole county. Sort of, you could overlay those two maps. And what that just shows is that there's a very high prevalence amongst Latinos in Milwaukee County. Now let's turn to the death rate. When you look at deaths, here, this is a picture since the beginning of the inception of the virus back in March for all races. You can see that the very high level of the high death rate at the beginning has tapered off. We really seem to be in a stable position right now in terms of deaths. The deaths tend to lag after the infection rates peak. So we may come into a peak, we don't know, we'll have to wait and see what happens. But as of now, they've been relatively stable. When you look at the death rate amongst Latinos, it's really a different picture. Again, Latinos being the green line in this slide, the death rates have been much lower than the other racial populations. We don't know exactly why that is. There is the Latino paradox has been seen in other diseases as well. There certainly is a protective factor going on here. And it's also one factor likely to be the age of people. So the Latino population tends to be a younger population here in Milwaukee, and is likely that the younger age is a protective factor in avoiding a higher death rate. And that's our staff showing the love for Milwaukee. And all the testing that we've been doing, large amounts of testing. But I need to give a shout out to our staff on what the great job they've been doing throughout this pandemic. So with that, Nancy, I will turn it back over to you.
Nancy, you're muted.
Thank you. One person has to do that in every single webinar, don't they? Thank you so much for sharing that with us. I'm very grateful for the Latino paradox, because we certainly that's a horrible outcome for any individual or any community have to undertake. And so while we don't understand it, I am very grateful for it. So thank you so much for sharing with us what is currently going on in our community and how some of those numbers have rolled out since the beginning of this pandemic. The next question that we have, we want to go to Christy Garcia Thomas. Christy, one of your largest hospitals at Advocate Aurora is also in the heart of the Hispanic community. And additionally, your team has been in the trenches with community, addressing education needs, testing needs, and ongoing care needs. Currently, the Hispanic community comprises 31% of all cases in the county, but only 16% of that population. 18% of all cases of infection in the state of Wisconsin, and only 5% of that population. And if we even take a broader lens to it, 29% of all cases in the United States and 18% of the US population. So knowing what you know about the Latino demographic and the health disparities that exist, do these numbers surprise you as a healthcare professional? And what are some of the key reasons that you think we are seeing the highest number of cases from our Latino community?
Yeah, thank you, Nancy. And it's an honor to be on the panel talking about such a critically important topic. Honored to be with all of the esteemed panelists. And quite frankly, we partner very much with MATC and 16th Street. We couldn't do the work we do without the key community partners, along with the Hispanic Collaborative, who helps to be a voice for the Latino community. So thank you all. Yeah, the numbers are, they're stark. Dr. Schuler shared the data. We know that Hispanics in Milwaukee are 3 times more likely to contract COVID. We know children under the age of 19 are 4 times more likely to contract COVID. we know that through the inequities that exist in our country and in our city and in our state, we know that we have greater health disparities in our communities of color, communities that are marginalized. And unfortunately, our Hispanic community is representative of the population that has significant health inequities. If you think about diabetes and hypertension, diabetes is very rampant in the Hispanic community. I know within my own personal family, it's it's the majority of my family members have diabetes, and so you think about the chronic conditions that our Hispanic population has, and you layer on COVID on top of that, we know that it's going to have a disproportionate impact on our community. We also know that a big factor in what's driving these numbers is that our Latino community is essential workers. They're not in a position to do virtual work from home. They're in a situation where they have to go to work because they're essential workers. A lot of times within our Hispanic community, and I know within my own family, you have multiple families living under one roof. And grandma, your abuelita, and your aunts and uncles, you can have extended families living under one roof. And unfortunately with COVID, especially with some of the education out there early on, we would say shelter at home with your family. Well, in the Hispanic community, family could be as many as 50 people. I know in my family, it could be more than 50. So, the education around COVID, we've done an extensive amount of community listening sessions, both in English and in Spanish. We know language barrier is an issue as well, and access to good information. And so by doing some of these listening sessions, partnering with our community leaders, partnering with the Hispanic community to understand what the needs are within the Hispanic community, we're hoping that we can continue to educate around the safety protocols that are necessary to keep COVID from spreading. But as you see, based off of Dr. Schuler's data, that the Hispanic community is contracting at a higher rate. Fortunately, the death toll is not as strong in the Hispanic community, but what we do know, and I think Dr. Schuler touched on it, is our community is a much younger community, and so you take all those variations in, and it's been a devastating disease, not only for the Latino community, but for the entire community at large.
Thank you so much, Christy, for that insight. And certainly a lot of what you said, kids home. In our household, we range from 12 to 93. So I really understand what you say. And, the viewpoint on essential workers is a thing for us not to forget about during Hispanic Heritage Month, as much as it's a time to celebrate our culture. The fact that they're getting impacted, and even if we don't have, even if the death rates are much more favorable to us, that's a huge economic impact into those households anytime multiple people may need to quarantine. And so let's keep that in mind during Hispanic Heritage Month as well, and let's make sure that we're all sharing out that viewpoint. So we want to turn to Drew. And I really appreciate your commitment to public health and D&I, Drew, and your background. And one thing that I have learned from you from being part of some of our weekly meetings is you're a data guy, and I really, really appreciate that and like that, and your use of data to help guide action to improve outcomes is a wonderful thing. So what surprises you when you start looking at our local Hispanic data? Is the data telling us something that we should be doing differently, or could be doing differently to improve our health disparities?
Oh, thank you very much for having me here, Nancy. You've been a great partner for so long. And I think, the data is only helpful if it's useful and if it's telling the right story. And so I think, Dr. Schuler, she presented enough, the broad overview, but I think we can tie a couple things together. First, where you live matters, and that's extremely important because overall trends, as she showed, were stabilizing in early summer during that period, but during that time, we also saw a sharp uptick in Hispanic cases and positive diagnoses. And Milwaukee County is very large, but in our own patient demographic, what we saw is that 70% of our Hispanic patients who were diagnosed were only in 2 zip codes, 53205, 53215, right? That was it. And so that was extremely helpful for us because it allowed us to target our messaging. It allowed us to collaborate more effectively with organizations like yours and really stay on track in terms of reaching the population efficiently. So where you live critically matters, and that's something that the data was able to steer us towards very swiftly. The second thing is that who you live with matters. And so, we've been talking about the household, and I think that's really important because nowadays we're still hearing that messaging publicly that, well, if you're young, you don't have to worry. Well, that's simply not true. What we saw even during that same time period is that not only were there zip codes where there were folks with cases among younger groups, middle-aged adults, and older groups, but in some zip codes, there was actually higher numbers among kids and higher numbers among older adults. And so when it came to what surprised me, well, at that time, we had schools closed and we had fewer people congregating. So who was driving it? Clearly, those working families who were essential workers on site, coming home, and even if they're mildly symptomatic or asymptomatic, those are your vehicles of infection, right? Those are the ones who are possibly increasing that risk. So when we talk about, what we can be doing as healthcare organizations, as societies, our messaging shouldn't just be about treating individuals, but treating families, treating households, and really staying on point there because we have to start looking at the risk as a shared risk and a shared accountability. And so once that pivot occurs, then we can start to identify ways, especially going into a flu season, of other preventive services and things we can be doing better and more broadly to target and to reach families and households where they are. And so let me pause there because I think, the data points, they kind of reinforce the fact we do see higher positivity rates among Hispanics, but at the same time, it's an opportunity for us to be more mindful of our outreach and to really make sure that we're meeting their needs.
So thank you so much, Drew. And, I think that is music to my ears of having an organization such as yours look at treating households because that's something that I think would be very effective and resonates well with the Latino community. It is a collectivist culture, and so that is very often how they think and feel and act as a household unit. So I will really look forward to hear how that thought and idea continues to unfold in Advocate Aurora's actions as it moves forward. Thank you. We're going to turn to Rosa Maria Martinez with us now. And Rosa Maria, in your position at 16th Street Community Health Center, you get to see how the social determinants of health play out firsthand. So when we blend the big picture and the local picture in terms of data, that matches what you, in many ways, are seeing at your doorstep, being in those key zip codes that Drew just talked about, and some of those challenges that we still need to address. Can you tell us, what does social determinants of health mean? And what does that mean for us trying to keep our community safe, healthy, and whole during this global pandemic?
Thank you so much, Nancy. I will start out by just kind of giving the more formal definition for social determinants of health, which are the conditions and the environments where people are born, live, learn, work, play, and age that affect a wide range of health and functioning and quality of life outcomes and risks. If you could pull up the slides I sent.
Yes.
So that's a more formal definition. What I would like to how I like to describe it is, I'll just kind of step back and ask you to just kind of picture yourself in a clinic right now. Picture yourself in the doctor's office and receiving high quality care. I'm a little biased, so I'll say they're at 16th Street, right? So that the provider is not only culturally appropriately listening to you and addressing your needs, linguistically also speaking your language, so giving you the high quality care. You walk out of that clinic and you go home and you find yourself a letter. Well, let's say you have diabetes, and so your provider had given you some insulin as part of your care in addition to other items. When you go home and you get that letter and you see that your energy bill wasn't paid and you're not going to have, perhaps you don't have the funds to pay for that, or your refrigerator wasn't working, where are you going to put that insulin? So that is a very, very simple example of what happens beyond those clinic walls. You can have the best quality of your care, but there are many things that are affecting your care. And that really is what social determinants of health are referring to. I'm a very visual learner, so the image that is pulled up right now is from the Healthy People 2030. And this gives a broad range of all of the things that affect our care, and they're not all inside clinic walls. And so many of them have been referenced by Dr. Drew and by Christy and by Dr. Schuler in terms of all those other items that are affecting our care. So our economic stability, whether we have housing or not, education and access to that education, and what our background is, what our literacy levels are. So it is, in essence, the social determinants of health, and I like to refer to them as social and environmental determinants of health, that in essence, it's a recognition that there's much more than just the exact health care and medicine that when you go into a clinic that affects your health. So I just want to, at 16th Street, we've been screening for patients. I've been working on a project to try to screen our adult patients in primary care and integrate the social determinants of health screening there. And in that, we have found that one of the things that had popped up to us is housing. About 4% of our patients that we have screened, and we've screened over the last years, a couple of thousand people, over 2,000 just from September to now, and about 4% indicate they don't have housing, but about 18% have indicating they're afraid of losing their housing. And so having that data and screening for those patients has allowed us to address that during COVID. So we've put together a relief funds to help assist some of our families in need for rent assistance. And that is probably something that's really come up a lot, rent and utility needs. So we've been able to address that. In terms of the National Association of Community Health Centers put together a document in the impact of COVID on prepared social determinants of health domains. And they referenced about 500,000 people being homeless and about 3 times that being afraid of losing their home. So we can see that here in what we've seen in our clinic is just a little bit higher than that. So it's important to document that need with our patients, and it's been helpful for us in an effort to address that.
Do you need me to go to the next slides at all, Rosa Maria?
Yes, so if you can go to this, sorry, I forgot that. Can you go to the next one? This is a model, and there are many different models that reference the social determinants of health. This is just one. This is pulled from the County Health Rankings model. And you can see that it's about, the clinical care that we reference is only about 20%. And that number changes depending on what model you look at. But this is in essence showing how all of these factors are related. How policies, if you look at the bottom left, how policies and programs affect our health factors, and in turn affect our health outcomes, and not only how long we live, but the quality of life that we live. And so you'll see many different items in here that are affecting our health. So clinical care, only about 20%, but the social and economic factors and our health behaviors and our environment really add up to the other 80% that are going to end up affecting our health. So there's a lot more to it than just our care. If you go to the last slide, this is just a quick image. Again, I'm a very visual learner. This is from the Robert Wood Johnson Foundation. And I just want to reference that when we talk about equality and equity and some of the disparities, we want to look at policies, which is not knowing that they're not all the same. So if I take myself and my care, my needs are very different than what my mother's needs would have been, right? And so equality is offering the same type of care to every single patient, but equity is referencing the appropriate care for that patient based on their needs. So this visual in my mind is I really like it because it just demonstrates how sometimes we reference equality in some of those cares and in terms of social determinants, but it's really equity and that we would like to see. So to address some of the needs, in particular, our Latino community has very specific needs that aren't the same as across all communities.
So thank you so much for sharing that. You know, I'm a very visual learner too, so it's very helpful for me to see some of those pictures. You know, it's also at the Hispanic collaboration is part of our name. But just to talk about the points of intersection and why are, you know, even these partners here at the table together today talking about these things, you know, what we saw from Rosa Maria's charts was that 50% were in environmental, physical, social, and economic pieces. And certainly the Hispanic Collaborative, through our key initiatives, are focused on those. And so how we can work together, you know, that 18% that Rosa Maria talked about that is concerned about housing, through a research project that the Hispanic Collaborative currently has going on, we know that the number of households that have missed major payments to rent or mortgage during this COVID-19 timeframe is about 35%. And that's the type of information sharing that we can use to maybe help apply funds or mitigate issues before they become, you know, a housing concern becomes a housing crisis. So thank you so much for that insight. It was very, I think, important to our discussion today. And one thing, what we want to do now, income, you know, education, occupation, income, those are some of the key issues that help shape our health outcomes, and they are big issues for Latinos in our community, and certainly one of the reasons that we're working on it. One thing I want to share, just remind all of the listeners or the attendees on the table, we will have some time frame to get to your questions. We invite you to go to the chat and type in your questions. We have 1 or 2 questions that we're going to get to before yours, but we do want to open it up to any questions from the listeners. So please begin to put those into the chat and we will start queuing up your question. So this is a question for all of you. What is the right approach on addressing health disparities for Latinos? We've talked about a lot of topics this morning. So what is top on your list for your organizations to address? Is this just about providing the best possible health care that you can, or are there other areas that your organizations are trying to work on? Any takers on who would like to get us started?
Sure, Nance, I'll jump in. You know, I was reflecting on, you know, Drew's comment about where you live matters. And Rosa Maria's presentation, and I love the visual, especially of the bikes, right? Because you want consistent, equitable outcomes across every segment, but the way in which you treat for that is very individualized. And so one of the things that we're strategically committed to at Advocate Aurora Health is that we know, depending upon the zip code you're born in, your life expectancy is as great as 16 years. So where you live does matter. And as Rosa Maria had presented, you know, as a healthcare provider, having excellent healthcare in our state and in our community, we have, with the breadth and depth of our clinical providers throughout Milwaukee, we have excellent healthcare. But it only controls about 20%. And it's those other social determinants of health. So we at Advocate Aurora Health have said, okay, we have to do more. We have to do more to address the inequities that are existing within our communities that we serve, because our purpose is to help people live well. And you can only do that by addressing some of the additional needs within our community. So we've made a commitment and a priority to begin to address food insecurities, because we know through our data, in addition to housing being one of the biggest issues, but in addition to housing, we'll be focusing in on food insecurities. Violence is a significant issue within our community, and we'll be focusing in on that, in addition to access to behavioral health and access to primary care. In addition to that, one of the things that we've launched is our commitment to economic development, because access to good jobs, good paying jobs, and then not just about getting people good jobs, but then how do you elevate and give people the opportunity to grow economically and financially. And so we've launched a $50 million economic community investment fund that you'll hear more about in the next 30, 60, 90 days, but how we will deploy those dollars to help address some of these social determinants of health within our own community. So that's one thing that we're doing, but we know that we can't do this work alone. It takes a broader community collaboration around all of these issues, which is why we work closely with 16th Street. We work closely with a lot of other additional community partners who are really strategically aligned with addressing the broader scope of issues that are impacting our Hispanic community. So I'll stop there, but that's just one example.
Thank you, Christy. Dr. Schuler, 16th Street is much, much more than a clinic. Do you want to talk a little bit about the areas that your organization has prioritized and kind of some of those other irons in the fire that really are about improving quality of life, but addressing health disparities?
Sure. I really feel that 16th Street is responsible for the health of our community. I kind of lovingly give a hug around our community and our neighborhoods that we serve, which probably not coincidentally are the same zip codes that Drew referenced, 53204 and 53215. We want to be able to help people live their healthiest life, no matter whether they're inside the four walls of our doctor's office or not. And so we do a lot outside the walls of the clinic to try and help people be as healthy as they can be. So wherever they live, work, play, so we're in the schools with clinics and mental health services to assist kids where they are most of the day and in a normal year. We're in the United Community Centers, Senior Center, so that we can assist the seniors in the place that they are throughout their day. We're in the parks doing work with our environmental health department, all with messages and education and information about how to live and stay healthy. And then one other area of focus that I think is really important and has become more important during COVID is our behavioral health or mental health services. We know that the levels of stress have increased tremendously for people for all of the reasons that you and I can think of and know. And we have seen an increased demand for mental health services, and especially in teens and kids, which is really the saddest part, I think. So we've been very much ramping up our services for mental health so that we can address kids and teens, again, where they're at. Out in the community, not necessarily having to come in to the four walls of our clinic, although that's available too. But again, as I think the consensus is building amongst this panel, the social determinants are so important, and people can have the best healthcare in the world, but if they have things in their lives that are impacting how they can care for their health, those are going to take priority. And so I very much agree with the social approach, and I hope we can all continue to work together to create more creative solutions. I think we all have to have more creativity when it comes to solutions that people can use.
Thank you so much. Thanks so much, Dr. Schuler. Drew, Rosa Maria, what can you add to this conversation? What are some of those other areas that you feel are important to work on to address health disparities?
Please.
Go ahead, Dr. Drew.
Well, I was just going to add very briefly to piggyback on everything that's said, but kind of focusing short term. Providing timely access to preventive services remains imperative as we enter fall. So for example, Wisconsin, let's focus just on flu shots. Wisconsin has some of the lowest immunization rates in the country at around only 35–37% overall. But when you look at our minority communities, that number drops to like 20 to 25%, especially in some of our hardest hit COVID areas. So we are rolling out a number of flu clinics currently and will continue to do so from now through the remainder of October and into November. And so getting a flu shot is an excellent way to reduce not only incidence of flu, but also flu-related hospitalizations. So it goes hand in hand with the broader preventive services, but to make sure that everyone has timely access to that, that they're receiving the appropriate messaging, separating fact from fiction on the scope of that protection is important. And then certainly, as we look long-term, just to reiterate, what Christy and Rosa Maria had both said, really looking at how do we leverage our existing resources, clinics, to do the kind of social needs screenings and referrals to organizations that have resources available that can also provide assistance in other areas that are detrimental to folks' health. So thank you very much for that opportunity, but we want to continue to do so both short-term and long-term. And I think one great way to do that is making sure that the messaging is accurate, but also that the services are available.
Wonderful, thank you. Rosa Maria?
Yeah, I just wanted to add, I think Julie gave a very great overview of what we're doing here at the clinic. A couple of things to add are, we're screening our patients and we really want to take that data and evaluate it. So I think one of the first things to address when it comes to social determinants of health is what is happening out there, and what is happening in particular with the population. And from that as well, looking for multi-sector partnerships, and we've been working on that as well. So for example, for housing, we know that the quality of housing is an issue. We've been working on lead abatement with the state and with some of our partners at SDC, rent assistance programs, and we're working with several health centers in terms of creating a community information exchange. So how do we coordinate that care throughout, not just in terms of coordination of care for medical care, but also some of those social needs that we have. And so there's a lot of work to be done, but starting with those partnerships and engagement and listening to our patients and to our community members, and continue to offer them the programs as best we can. So stop there.
So thank you so much, Rosa Maria, and to all of you for really some wonderful responses and very insightful responses to that. I want to just remind our attendees, we will have some time for a few questions. If you haven't already typed your question into the chat, please put those in there. We will get to all of them, possibly not live in person, but we will, as part of posting the recording of this webinar, we will also include your key questions and responses to them. So we will answer them outside of this webinar and put those answers in writing so that you have those from our panelists, or get you those answers if we can. One more question for each of you. I think a component that each of you have alluded to is, there are, I guess, two parts to every equation. And the other side of the equation that we're talking about here is community itself, right? Latino community. Are there things that the Latino community could do differently, approach differently, take a more active role in, or that might expedite or assist addressing some of these health disparities? Thoughts from each of you on that?
Okay, I'll go. I think to pick up on Drew's, where you live matters, your voice matters. And as a Latina, I know culturally growing up that, there's cultural differences in how you showcase your voice at the table. And, for me, culturally, I've had to get very comfortable with making sure that my voice is heard at the tables I'm at. And I think it's really important for our Hispanic community. We're large, we're strong, we're smart. We need to lean in with our voice. And we need to make sure that our community leaders, our politicians, the society at large has a broader understanding of what matters to us and how we can work collaboratively together to address these issues. So I encourage the community to use their strong voice to share their opinions and thoughts with any opportunity that they have.
Thank you, Christy. Others?
I'll add to that. I think that it's not only important to be informed, but also engaged, right? So any project or any items that are happening in the community should not just go in and say, here, this is what's happening, but rather how to be informed by the community and take that to heart and be a partner in that voice. And so I think it's a bit scary sometimes for people to think about, oh my gosh, what could I possibly add? But I've gone to schools and I've heard some kids, even youth, who I've heard them say, here, we're working on this project. Oh, I didn't think I had much to say, but really what they have to say is phenomenal, and it is their experience. And so I would suggest that people take a look at, maybe start with something small, maybe start with think of your experience of whatever it may be. Whether it's experience in how, issues with your housing or whatever, maybe violence or improvement in the community, and take that small piece and be engaged. Is that, that document I shared that shows how they're all related really starts with policies, right? And what's going on. And if we don't inform those, I think that they could potentially be without, our voice can really hurt the community in terms of where it goes. The other thing I just wanted to mention, another reason why raising your voice is so important. So I shared that image from Robert Wood Johnson of equity versus equality. And it's, as I mentioned before, my care is going to be very different than my mother would have asked for, than what my husband would ask for, than what my kids would ask for. And so it's that diverse experience. Here at 16th Street, we have a patient and family advisory committee. Our board is very diverse, and it's intentionally to be of members that are utilizing our services. And we listen and we meet with the neighborhood associations and meetings, and those are just some of the examples. But it is there that we really get a lot of information. We sometimes run by things, and this is what we're thinking, and the feedback is valuable, and it can guide us in our response. So I just want to underscore the importance of voice and engagement, and finding a place to do that across the community.
Thanks so much, Rosa Maria and Christy, and Hispanic Collaborative couldn't agree more. Civic participation is one of our strategic priorities, and that's not just about, are we exercising our right to vote, but it's also how many elected officials do we have that are from our community, how many of us are expressing what we feel in neighborhood meetings or participating in initiatives and events that influence how we live and where we live and what type of resources are allocated to our community. So thank you so much, both of you, for hitting on that. And I certainly think that you're right. As a Latino community, we could do that better, because we certainly are have numbers and power and intellect and capital, both in what we spend to leverage that influence. We're going to go to a quick question from one of our attendees. The question is what type of assistance right now is available for undocumented immigrants, especially those that are, maybe fearful of asking for health services? Can you each talk a little bit about how you guys specifically address that in the healthcare and access that you provide, and what maybe challenges and or opportunities are out there based on what each of your organizations provides in the healthcare arena?
Nancy, I can start on that one. 16th Street welcomes everybody. Whether you have papers, you don't have papers, you're documented, undocumented. I truly believe, and we truly believe, that healthcare is a right that everybody deserves, high quality healthcare. So we don't ask, and we don't ask for a social security number, and so we don't know if people are documented or not documented. We offer a sliding fee payment scale of $15 a visit for anything that's included in that visit. You could have 4 vaccines and blood tests and all sorts of other things, and it's still just the $15. So I'd like to express how warmly we feel towards all of the community, and we'd like for everyone to access care. Yeah, so that's what I'd like to say. Please come. We're happy to welcome everyone.
And thank you.
I'd like to add a little bit to Julie's comments, is that yes, we don't ask that question, and still that question, sometimes even though we don't ask it, sometimes people are afraid that for whatever reason, for whatever information is out there, they might feel like it's going to be used some way, somehow. So we do work hard to try to inform people that, we're here, the services are here for them, whether it's Women, Infants, and Children's Program, so the WIC program, any of our resources in going out to the homes and helping with lead abatement, any of those services, social services, as Julie mentioned, those are all part of engagement with the patient, and so it's no additional cost to them. But we do have to recognize that there is some concern out there and some fear, perception.
Yeah, I would just echo and build off of that, and specifically, I mentioned before, our purpose at Advocate Aurora Health is to help all people live well, and doing that in different and unique ways is something that we have to be thoughtful about, which is why we have Walker's Point Community Free Clinic. It's on the south side of Milwaukee, and it's the largest free clinic in the state of Wisconsin, providing not only excellent clinical care, but providing mental health services as well as domestic violence and dental care as well. And recognizing that access to care and understanding some of the fear that exists within our community is, this is just one example of how we uniquely position our ability to serve all people with open arms.
Thank you so much, Christy, and for that response, as well as Julie and Rosa Maria. We want to thank all of you for being with us here today. We have more questions, great questions in the chat that we promise you we will post the responses for you, including a little bit more about the Aurora Fund and some of those numbers that I know some of you were interested in, specifically with Waukesha. So please take a look at that, give us a day or two, and we will have that posted on our website. We want to thank Advocate Aurora and 16th Street Community Health Center for caring and investing in the Latino community, and specifically for Christy, Julie, Drew, and Rosa Maria for being on our panel today. Please consider joining us on Thursday this week, on the 8th, for our discussion about Latino-owned businesses and what we need to do to grow that sector. And to finish us out, thank you to our partners at MATC and for all they're doing in our community. And to finish us out, we want to bring Dr. Vicki Martin back on board. And we at the Hispanic Collaborative wish you a safe and enjoyable Hispanic Heritage Month. And here is Dr. Vicki Martin.
I don't know if Vic is here, but on behalf of MATC, thank you so much. We really appreciate this partnership. The panel for today, certainly this is a very important topic for our community and our effort to understand the impact of this global pandemic and the Hispanic community is very imperative. Thank you, Nancy. Thank you, the panelists and the attendees. Have a great day.
Thank you.
You as well. Thank you very much.